Powers. I'm going to be your nurse practitioner student today doing your physical exam. Is that okay with you?
Sounds good.
All right, great. First I'm going to start with washing my hands. And as I wash my hands, I'm just going to do a general assessment of Mrs. Powers, her appearance, her hygiene, her general mood. And if she were to walk in here and I hadn't assessed that, I would have been able to see her gait and her general appearance as well. Okay, so I did start with looking over your vital signs today, and it looked normal. The CNA was able to get those for me. But I'm going to start with feeling for your radial pulse and counting your pulse for 15 seconds and multiplying by 4. And after that, I'm going to stay right here and count your respirations for 15 seconds and multiply by 4. Next, I'm going to do a general assessment of your skin. And I'm going to start with your arms and just look, sorry about my cold hands, your temperature are equal. I don't see any lesions, any masses, any rashes. Inspecting your fingernails, checking your cap refill, which is normal, and your turgor. And can you squeeze my hands, checking your strength? Very good. Now I'm going to look at your scalp, and can you put your head down slightly? Thank you. First, inspecting to see any dryness, any masses, anything, and you're going to feel me palpate. Checking your symmetry and your hair pattern. Okay, very good. You can sit back up. Okay, Mrs. Powers, I'm going to check your pupillary response now. So can you look straight at the wall behind us there? I'm checking your pupillary response and accommodation. That is cranial nerve 2. And accommodation. Okay, very good. Next, I'm going to have you cover one eye, and I'm going to check your peripheral vision here. So tell me when you can see a number here.
1.
And which number is this?
2.
Here?
1.
Here?
2. 1.
Okay, and the other eye? And continue to look straight at me.
1. 2. 1. 2.
Okay, now you can put your hand down, and will you follow my finger with keeping your head straight, checking your 3, 4, and 6 nerves. Okay, very good. Now can you close your eyes? I'm going to inspect your eyelids, looking for any abnormalities, looking at your eyebrows, and then if you can open your eyes, your sclera is nice and clear, conjunctiva is pink, looks great. Okay, so now I'm going to check inside of your eye. So if you could again look straight forward. First I'm going to check for your red reflex. Okay, and the other side. Those are both equal. And so if you can just continue to look forward, this might be a little bright. Okay, your macula looks pink and healthy and yellow, and your AV ratio is 2 to 3. And again, keep looking forward. scapula, and arterioles and venules also look healthy there. Okay, Mrs. Powers, now I'm going to assess your ears. First, I'm just going to look around, inspect your skin. I don't see any kind of masses. It looks nice and healthy. And then I'm going to feel. Do you feel any tenderness there on your tragus?
No.
How about if I pull on your pinna?
No.
Okay, very good. And now I'm going to look inside of your ear as I pull. Okay, your tympanic membrane is pearly gray and pink. And I can see your 3 bones perfect. Now I'm going to do the same thing on the other side. First inspecting and behind the ear. And any tenderness there on your tragus?
No.
And your pinna?
No.
Okay. I'll look inside here. Again, your tympanic membrane is pearly gray and pink, and your 3 bones are visible. Okay, now can you close your eyes? And I'm going to check your cranial nerve 8. Where do you hear this at? On your left or right?
Left.
How about this?
Right.
Okay. Now I'm going to do a nose and mouth exam, but because of COVID, I'm not going to actually physically do it. I'm going to just talk you through it. So first I'm going to assess your nose on the external, checking for straightness, position, and palpate for any tenderness. And then I will look inside your nose with the light on each side, checking for the turbinates, the septum, making sure it's not deviated in any way, and then checking to make sure your mucosa is nice and pink. And then I will have you check your patency of your nose by checking each side individually and breathing out at the same time. Okay, so now for your mouth assessment, can you stick out your tongue? Checking your cranial nerve 12, and then move it side to side. And then I will have you smile and frown and puff your cheeks out, checking your facial nerve. And then next I will have you say ah, checking cranial nerve 10. And as you were doing that, I would have looked inside your mouth with a light and checking your uvula going up and down in the whether it was symmetrical or not. And then I will do a in your mouth assessment, both with the tongue depressor and the light, looking at your gingiva, your dental, your tongue, and up the top and the bottom of your tongue, and their palate, and all in there. I'm just going to palpate your frontal sinuses. Any tenderness there?
No.
And your maxillary sinuses, any tenderness there?
No.
Okay, I don't feel any fullness. Okay, now I'm going to begin your neck exam. First I'm going to check your lymph nodes. It'll be your facial nerves, your submental, your cervical, superficial, and deep. Occipital, superficial, and deep. Subclavicular, pre-auricle, post-auricle. And now coming to your trachea, you're going to feel me touch here, checking midline. Okay, very good. And now checking your thyroid. Okay, that is not enlarged. Perfect. And go ahead and swallow. Okay, that moves nice and smooth. And your glossopharyngeal nerve is also intact. Okay, next, can you push up on my hands, the hands for resistance? Okay, so spinal accessory is intact. And then can you look to the left and to the right and go midline and look down and look up. And then bring your ear to your left shoulder and to your right shoulder, and your range of motion of your neck is intact. Anything tender there or painful? Okay, very good. Now I'm going to begin your chest and back exam. First I'm going to have you put your head down slightly and forward a little bit more. Very good. Here I'm assessing for any scoliosis, lordosis, or kyphosis, and you're going to feel me palpate. Any tenderness there?
No.
Okay, great. Nice and straight. Okay, so you can sit back up. Okay, so now I'm going to check your tactile fremitus, and when I touch, you can say the word 99.
99. 99. 99. 99. 99. 99.
Okay, so now take a deep breath, checking your respiratory expansion. Okay, very good. Checking your CVA tenderness. Any tenderness there?
No.
Okay, now I'm going to listen to your lungs. When I touch your back with the stethoscope, please take a deep breath. Okay, now I'm going to assess your respiratory status anteriorly. I'm going to listen. Again, taking a deep breath when I put the stethoscope down. Thank you. Also, while I was listening there, I was inspecting your respiratory pattern there. It was nice and easy, and your chest AP ratio was also normal, 2 to 1. So now I'm going to start your cardiac exam. First, you're going to feel me touch your pericardium, feeling for any thrills, lifts, or heaves. Okay. And now I'm going to get right a little personal here and feel for your point of maximal impulse. Okay, it's right about there at the 5th intercostal space in the clavicular line. Very good. Okay, so now I'm going to listen to your heart sounds here. Your aortic, pulmonic, second pulmonic, tricuspid, mitral valve. Okay, so Ms. Powers, can you now lay down? And I'm going to listen to those same heart sounds as you're laying down. Aortic, pulmonic, second pulmonic, tricuspid, and mitral valve. Now, while you're in this position, I can look at your jugular vein distension. So again, just look right up at the ceiling there. I can see your aorta, and I want to look at your jugular here. Okay, perfect. I'm seeing your normal jugular venous distension, and this is where I could measure it to check your CVP as well. Okay. now I'm going to start your abdominal exam. Yeah, can you lift up just up to the top of your, perfect, okay. So first I'm just going to inspect, looking for any obvious masses, hernias, any skin abnormalities. Yeah, everything looks good there, okay. So actually next I'm going to listen, and you have 6 quadrants I'm going to listen, so just stay nice and still, breathe normal. Okay. A little ticklish, sorry. Okay, those are all active. A couple more here. Okay. So next I'm going to percuss your abdomen here, listening for dullness, tympanic, dullness, tympanic, tympanic. Okay, very good. Now I'm going to lightly palpate. Let me know if there's any tenderness here. This would also be an opportunity after this if I wanted to listen to your aorta and check for any groovy there. And then if I saw anything abnormal, I would do a deeper palpation of your liver, your kidneys, maybe your appendix, maybe your gallbladder, and possibly your spleen as well. But that all looks really good. You can cover back up there. Okay, next I'm going to go to your lower extremities here and just do a general inspection, symmetry, your muscle mass looks even there, and then checking your knees for any swelling, your posterior fossa for any cysts, again, knees for any swelling, posterior fossa. Okay, that awesome. Seems normal. Okay, so next I'm going to check your range of motion of your knee and your legs here. So can you lift up? Yep. And then back down. And then I'm going to put your adduction here with your knee and then abduction. Okay. Same thing over here. Lift up. Okay, adduction, abduction, okay. Now I'm checking your strengths. Can you push up towards the ceiling and down towards the bed? Okay, up and down. Okay, very good and strong. Okay, now your dorsiflexion up back towards the ceiling and then down towards the floor. Okay, checking your pedals, post-tib, inspecting your toes, checking your cap refill, inspecting your ankles for any edema, any swelling. Okay. Very good. Now you can sit on the side of the bed here. Okay. So after doing that motor exam, if you had any abnormalities, I would have done a more thorough musculoskeletal exam at that time. Okay, now I'm going to check your reflexes, starting with your brachial. So if you can just have your arms straight here. Oh, very good. Other side. Okay. Tricep. Okay. Tricep. Okay. Brachioradialis. Oh, there it is. Brachioradialis, patellar. Ooh, there it is. All right, very good. And now Achilles. Achilles. And you have a plantar reflex. Okay, those are all normal. Very good. Next, I'm going to check your sensory. If you could just close your eyes and tell me if you feel sharp or dull here. This is sharp and this is dull. Okay, I'm going to do this on your upper and your lower extremities. What do you feel here? Sharp, dull, dull, sharp. Do it again. Dull. Very good. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Do it again. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Okay, so now I'm going to check your coordination. You can open your eyes. I want you to take your hands and go up and down fast. Very good. Okay, next, take your thumbs and go to each of your fingers and do that as fast as you can. Okay, very good. So now, can you touch your nose and bring your finger to my finger? Touch your nose. Good coordination. Okay, very good. Okay, so now you can put your shoes on. And I just want to check your gait, your walking. So can you just walk to the door there? And then turn around and do a heel to toe walk back. Very good, very good. And then when you get to me here, I want you to stop, close your eyes, and I'm going to count to 5. 1, 2, 3, 4, 5. Your Marburger test is normal, good balance. Okay, that concludes my physical exam today. You can go ahead and get dressed and then just sit and wait for me. I will come and give you the results of your exam. Wash my hands.